Hi, I'm Christine. I'm one of the nurses at Von Voigtlander Women's Hospital, and I am on our bereavement task force, and I am here to show you how to set up a CuddleCot. In Von Voigtlander Women's Hospital, we currently have 3 of these stocked in our loss room, but for the remaining Mott Hospital, they can be ordered from patient equipment. We do have the ability to order these if all of the CuddleCots are in use in Von Voigtlander Women's Hospital. We can also order them from patient equipment. This is a CuddleCot that we provide to our patients and families who have lost a baby and they want to spend more time with their baby. What the CuddleCot does is it helps to preserve the baby so that they can spend as much time with their baby as they want to, and it does that by keeping the baby cool. So this is the equipment that you will need when you are setting up your CuddleCot. So obviously you'll need to order your CuddleCot from patient equipment. You'll need a bottle of sterile water, a blue pad or our large white pad folded in half, some baby blankets or a pillowcase if your unit does not have baby blankets, and a heating pad that goes with our normal heating pumps. So we have our CuddleCot here on the end of the crib or bed that you're using. We have a large white pad. For smaller babies, you can use a small blue pad. So either or will work. Our pad down first, then our cooling pad next, and then a baby blanket or pillowcase on top of that. You take your connections and you plug them in. Make sure they're secure and they're not clamped. So before you turn your CuddleCot on, you want to make sure that it has enough water. You don't want the water to be higher than the red line here, but it needs to be at least that high. To fill your CuddleCot, you open up this little cap here. You grab your sterile water, which is the same as distilled water, and you fill until it reaches that line. We're going to replace our cap, and now we can turn our CuddleCot on. You do have to press the button and hold it in for a couple seconds for it to turn on and off. This is going to be your Fahrenheit and Celsius button. And these are going to be your temperature buttons. You want the temperature at 46 degrees. Once the CuddleCot is turned on, it will start to cool and you'll notice the degrees gradually decreasing. Once your CuddleCot is starting to cool, you want to make sure you have a blanket over your cooling pad. You can place baby on the cooling pad. Baby should be wrapped or swaddled. That's going to help insulate the baby even more and keep baby cool. Once you are done using the CuddleCot, you can turn the CuddleCot off. This pad can be thrown away in the garbage along with your other pads that you used. And your CuddleCot should be returned to patient equipment, or for Von Voigtlander Women's Hospital, it should be wiped down and put back in the loss room. When troubleshooting the CuddleCot, one of the first things you want to do is make sure it has enough water. Let's turn our CuddleCot on. and we immediately hear this chirping noise. When the CuddleCot starts filling up the cooling pad with water, the reservoir will go down. What you want to do is make sure that the reservoir is filled at least to the red line. So what we're going to do is we're going to add more water to the reservoir, and that should take care of this chirping noise. There's a chirping noise, and also there is a little water drop that will flash. One of the other things you want to check when troubleshooting the CuddleCot is the fan on the top. The fan can sometimes get clogged with dust and it might not work properly, so you want to twist it counterclockwise and lift it up. As you can see, there is some dust on this filter, so you're going to want to clear that dust out and then replace it by turning it clockwise and locking it in place.